Hi, I am Dr. Ashraf Armia from Cairo, Egypt. I'm a consultant ophthalmic surgeon. I am founder and medical director of Ashraf Armia Eye Clinic in Cairo, Egypt. I'm founder of ATWA, which is Armia Ophthalmology Training Observatory Academy. Founder of GERSO, Global Organization for Education and Research Work. Biotech Healthcare, it's a very innovative company bringing us a new technology, which is the Optiflex TRIO. It's a trifocal IOL for our patients. This new technology makes our patients glasses independent, and they are happy when they need the vision for distance, intermediate and near. This new technology coming from Ireland, manufactured, and the raw material for the IOL coming from the USA. This makes us feel free to suggest this IOL for our patients because we need a trustable technology. This new IOL, it's very important to know the features of this IOL so you can differentiate what you want for your patients, because there is a lot of trifocal technologies in the market, but you must select the technology which fits your patient in the proper way. What TRIO can give us? TRIO has a lot of features. The optical zone for this IOL is just 4 millimeters, which makes our patients less dependent of the pupil size and less glare and halos in night vision. One of the most important features of Optiflex TRIO from Biotech is the BLESS technology. What's BLESS technology? It is the brilliant light sensing system. What this means? It's designed for natural adaptation. Each part of the light is used in the perfect way. Each focal point designed to be used for intermediate and near without affecting the distant or the quality for distant vision. It's also one of the best in BLESS technology is pupil independence, which make our patients satisfied post-operatively. Also, in this Optiflex TRIO, it's a natural yellow color, which filters the violet and blue light, decreasing the instance of age-related macular degeneration, which is very important issue in our patient because most of our patients are old age doing cataract operation. What else in this technology, Optiflex from TRIO from Biotech? It has a very nice transitional zones by the diffractive ridges on the lens. What else? This lens has a smooth surface with a round edge. This makes the lens very tight to the posterior capsule and decrease the PCO for our patients. It also has a smooth anterior surface, and this decreases the deposition of bacteria and the inflammatory cells on the optic for this lens. It's also very important that it is a negative spherical aberration. The optic is negative spherical aberration, which neutralize the positive spherical aberration for the cornea. And this makes our patient less spherical aberration post-operatively. It also decreases the chromatic aberration by the technology of the BLESS technology. Is Optiflex TRIO suitable for all our patients? No. It's very important to evaluate our patients if they are fit for this TRIO or trifocal technology or not. We have 3 main systems as optical system of the eye. So from the front, we need to have a very well-wetted eye with no severe aggressive forms of dry eye. If we have a dry eye, we should control it before we suggest this technology for our patients. We must see the cornea, if it's normal cornea or it's abnormal cornea. So topography for the cornea is very mandatory, and we don't go for steep cornea or flat corneas to give the patient the optimum function of this lens. What about the retina? The retina should be normal, with no signs of any abnormality in the macula or the optic nerve, because this IOL depends during the refraction process of the light. It should have a good macula and good optic nerve. What about the post-operative results? In my patients, since I started this technology, I got a very nice results. But maybe in the first 2 or 3 patients, I was not happy. Not from the IOL, from the calculation. So I reached the best calculation for this patient using the Barrett formula. So when you use this formula, you are going to be happy with your results using the Optiflex TRIO from Biotech. How I'm using the biometry for my patients? I usually go for the dominant eye, nearly emmetropic, and the less dominant eye, the first line for little bit myopic. So both eyes, I'm going to have a very nice curve for distance, intermediate, and near. What about the angle kappa and angle alpha? Very important to know that when you use a technology like this, your angle alpha must not exceed 0.5. It should be below 0.5. More than 0.5, we don't recommend any trifocal technology. Angle kappa does not differ a lot in this lens, because this lens will going to be centralized inside the bag, so we are not going to be fair if there is any abnormality in angle kappa. I don't talk about extremes. I don't little bit increase in the angle kappa. My last words. Trifocal technology for your patient is very good. You should suggest it, but be sure that your patient is fit for this technology. Healthcare Biotech is giving new innovations in ophthalmology, and Optiflex TRIO is one of the best innovations that give your patient glasses independence. You are going to feel happy because your patient will going to be feeling happy. Thank you.